friends, I am Dr. Prachi, MBBS and MS ENT from AIIMS and ex-senior resident from PGI Chandigarh. Today we are going to discuss about the diseases of the external nose. It has been divided into choanal atresia, nasal deformity, tumors and foreign body and maggots. Choanal atresia. The theories behind formation of choanal atresia are persistence of buccopharyngeal membrane, inability of the bucconasal membrane to rupture, medial outgrowths of vertical and horizontal processes of the palatine bone. It can be either bony, mixed or membranous. And how do you diagnose the patient to have choanal atresia? If there is an inability to pass a 6 French catheter. The newborn presents with cyanotic episodes which are present when the mouth is stoutly closed and they are broken by spells of crying. This is how the atresia presents like. There is no opening at the back of the nose and the nasal cavity abruptly stops. The management. You can give an oral airway for the patient to breathe through the oral cavity. Children are obligate nasal breathers. So, if they are not able to breathe through the nose, then it becomes very difficult for them to breathe. You can give them a McGovern's nipple, which is something like the nipple that is present in the bottles and there are holes over it so that the child suckles on air. You might require to do an ET intubation or an intubation for a child who has bilateral choanal atresia at birth. In surgery, you can do a transnasal puncture, a transpalatal repair, a microscopic drill out procedure, endoscopic and powered instrumentation can be used, or a sublabial transseptal approach for managing the choanal atresia can be done. Then we come to nasal deformities. The various nasal deformities are saddle nose, hump nose, crooked nose or deviated nose. Saddle nose, if there is a depressed nasal dorsum, it can be either bony or cartilaginous. It can have both components of the nasal dorsum. It is mostly after nasal trauma. The depressed fractures most commonly lead to saddle nose deformity, or there can be excessive removal of the septum in submucosal resection, and the septal cartilage can be destroyed by a septal hematoma, septal abscess, syphilis, tuberculosis or leprosy. In any of these conditions, the patient can have saddle nose. As you see, this is what a saddle nose looks like. It can involve the bony cartilaginous part or both the components, and it is due to excessive resection. The reconstruction gives a better shape. The treatment is with augmentation rhinoplasty by filling the dorsum with cartilage, bone or implants. A hump nose, this is what a hump nose looks like. It can involve the bony part or the cartilaginous part. It is corrected by reduction rhinoplasty, that is the removal of the hump and narrowing of the lateral wall. A crooked nose or a deviated nose, in this the nose is crooked. The midline of the dorsum from the frontonasal angle to the tip is curved like a C or an S. In deviated nose, the midline is straight but deviated to the one side. These deformities are usually traumatic. The treatment is septorhinoplasty or rhinoplasty. Next we come to the tumors. The tumors can be congenital, benign or malignant. The congenital tumors include the dermoid cyst, encephalocele or meningoencephalocele or gliomas. The dermoid cysts are of two types. A simple dermoid, it occurs as a midline swelling under the skin but in the front of the nasal bone. It does not have any external opening. This is a simple dermoid. A dermoid with a sinus, it is seen in infants and children. It is represented by a pit or a sinus in the midline of the dorsum of the nose. Hair can also be seen protruding through the sinus. In these cases, the sinus tract may lead to a dermoid cyst lying under the nasal bone in front of the upper part of the nasal septum, or may have an intracranial dural connection. This is an important point, that a dermoid with a sinus can have an intracranial dural connection. In those with intracranial extension, the sinus tract passes through the cribriform plate or the foramen cecum and is attached to the dura or has other intracranial connections. The treatment includes splitting of the nasal bones to remove the extension in the upper part of the nasal septum, and a combined neurosurgical and an otolaryngological approach is required in patients who have intracranial extension. Encephalocele or a meningoencephalocele. There is herniation of brain tissue along with its meninges through a congenital bony defect. They can be nasofrontal, that is, the subcutaneous pulsatile swelling is in the midline at the root of the nose. They can be nasoethmoid if are there at the side of the nose, and nasoorbital on the anteromedial aspect of the orbit. A very important sign or test, the Furstenberger test, if a bilateral compression of the internal jugular vein is done, it leads to increase in size of the mass. In positive Furstenberger test, it is seen in the cases of nasal encephalocele because bilateral IJV compression will lead to increased intracranial pressure, which will get transmitted to the meningoencephalocele. But since gliomas and dermoid cysts do not have an intracranial connection, thus the Furstenberger sign will be negative. The swelling shows a cuff impulse and can be reducible. Similar to the Furstenberger sign, the cuff impulse is also due to the increase in the pressure which is transmitted to the swelling, and reducibility is because of the area present. The treatment is mostly neurosurgical. You have to remove the tumor stalk from the brain and repair the bony defect through which the herniation has taken place. What is a glioma? It is a nipped off portion of encephalocele. It does not have connection with the brain. The 60% are extranasal, that is, they present as a firm subcutaneous swelling on the bridge or the side of the nose or near the inner canthus. 30% may be purely intranasal and 10% can have both intranasal and extranasal components. Extranasal gliomas are encapsulated and can be easily removed because they are basically heterotopic glial tissues. So, this was about the congenital malformations like choanal atresia, gliomas, meningoencephalocele and dermoid cyst.